Hi, everyone. I am here in Las Vegas. Love to say that. I've said it a few times with Dr. Josephine Weber from the Bay Area, from San Francisco. And she goes and her partner, Dr. Bautista, on FaceTime, they go everywhere. Unfortunately, I can't be in San Francisco to interview them. So I'm excited to have you on FaceTime and you in person. And we are going to talk about some questions, frequently asked questions, which would be, my loved one has Alzheimer's disease. I look in the mouth and it looks bad. Can you help them? Even though I think they may be difficult and you may not be able to drill. Dr. Bautista, what do you do for these patients?
We can easily come out and meet your loved one. We can do a filling without any drilling. We can just clean the tooth, simply clean it, and then seal it with a product called silver diamine fluoride, which helps clear out the cavities and kind of maintain them so that it doesn't progress. And then we seal it with a filling material right on top so it's nice and smooth. We're not worried about if, your loved one is cutting themselves while they're chewing or eating or just, simply as is.
And at the very, very worst case scenario, if you can't get that filling in, you've arrested the decay, you've stopped it in its tracks, and if it has to just stay that way, you come back for the second treatment, and then you come back every couple of months, 6 months, and you do it again.
Yes.
And it's just a drop that you put right into the tooth. There's no pain, there's no taste. A little bit of taste, but nobody really complains about that. But it's really worth it. What about patients that won't open? How do you deal with that?
Oh, we have props that we can use to keep the mouth open. We have a block, and we also have a prop that opens them up, and it's pretty comfortable. It's not very invasive, so that helps us so that we can see.
And what's the most difficult encounter you've had? If you can, I know I'm putting them on the spot, it's not really nice, but we all have our story that we like to tell. Is there a story that you would like to tell about a patient who the family could not believe you were able to treat, or something that happened in the house that's funny? Any of those stories?
Yeah, I have a few. I have a few that bit me, but that but
that's bad.
Once we put the block in there, we were able to finish the procedure, and this patient was particularly
demented.
Yes, very, very. And so we were able to get in there and do the job, and the patients, the caregivers, were very, very pleased that we were able to solve the problem.
Yeah. That reminds me, I was only bitten once, and not only did the patient bite through my fingernail, and I had so many emergencies, I had to wait to go to the OR, emergency room, not the OR, in the evening. Not only did they bite through my fingernail, I had to have my fingernail removed, they pulled my earring out of my ear, and it went under the refrigerator. I think I was more upset about the earring because the nail healed. Dr. Bautista, give me your craziest story. Just lay it on us.
Craziest story. Well, because, their own way of how they live, and so when we go to these homes, when we go to our patients' homes, we see everything. And so we don't know who you live with, and what's your living situation until we really get there. And so it's interesting when we get there and there's a ton of people, and it's just like a full-on show for the family. And obviously the family's there to make sure, their loved one is taken care of. But sometimes we have a full production with mom, dad, grandpa, grandkids, and the full shebang. So you never know what you'll get.
It's crazy, right? I like when that happens sometimes because I'm so confident, and I know you guys are too, that it's almost like an experience for them. So, hey, to each their own. And if you want to see grandma get a tooth extracted, we're here for you. We'll try to make it fun and funny. I mean, I try to make it a good experience for the patient and for the family.
Absolutely.
And I want them to feel so comfortable. I want them to feel that this is not like a service. You're not calling a service and a nurse is showing up for an emergency. We are actually going to be like part of your life. And I would say that we have tricks of the trade. And my favorite trick of the trade is when I know a patient won't cooperate, I always find out the name of their kid. So I would go in there and say, hi, I am your daughter's. We went to high school together. Do you remember me? Oh, no. And I'm here because I came very far as a favor to your daughter. And I'm here to take out your tooth because your daughter trusts me. So little things like that. I mean, we amuse ourselves, we amuse the patient, we amuse the families. And as much as this is a job, we love it. And having us to your homes, we're all in it as an experience and to make it a great one, right?
Yes, yes.
So if you're looking for someone in San Francisco, the Bay Area, and they go all over, please call, go on our website. Do you guys have a phone number or they have to fill out a form?
It's on there.
It's on there?
Yeah.
Because I have my phone number, but if there isn't a phone number, maybe we should